Okay, you're not yourself when you're in pain, that's for sure. And here with the solution to the problem is orthopedic surgeon Ian Gradisar from Crystal Clinic. And we're talking about hip replacements now. And I remember when somebody got a hip replacement, like even 5 years ago, they were messed up for a long time. It's not like that anymore, is it?
Oh, no, correct. It's much different now than it used to be, even just 5 years ago. In fact, one of the ways we have made that different is a new approach to the hip. It's called a direct anterior approach.
So what does that mean?
Well, there's a couple different ways to get into the hip joint. The traditional ways are along the side or more posterior along the hip or towards the back. The approach we're doing now is an approach in the front, small incision that goes in between muscle layers. So we're not taking the muscle off the bone like we used to do, so recovery tends to be a little bit quicker.
So the biggest problem really was when you try to get all those muscles to heal, it's painful when you move, and then you're in bad shape for a long time because the muscles take so long to heal.
Correct, that's exactly it. So, and we would do more precautions that way too, so you wouldn't be able to pick things up off the floor, but now we're getting people moving up quicker with less pain.
Are there precautions people can take to avoid having a hip surgery in their future, or is this just something that's genetic and you're going to have to deal with?
Well, a lot of it is genetic, but we do see that there are some things that can help you out. People that stay active seem to make their hips last a little bit longer. Keeping that strength up around the hip really helps.
So to be in good shape it's always the right thing to do.
Correct, and keeping mindful of body weight and stuff like that also helps too.
I bet a lot of people are fearful. They have pain in their hip, and they're sort of fearful of going for a procedure that sounds like, you know, it's almost like a head transplant. You know, you're having your hip redone, and they shouldn't be afraid, I guess.
No, correct. You know, a lot of people are in a lot of pain, and they may not even realize it. You get an x-ray and show your bone on bone, and a hip replacement, again, it's not like it used to be. So if you've heard those horror stories, it's not like it used to be.
You know, I visited my brother in the hospital yesterday, and the guy next to him just had a hip replacement, and his hip hurt him so bad before that the pain he experienced a day after the surgery was nothing compared to the pain.
Exactly. You wake up, that arthritis pain is gone. You'll have a little bit of therapy afterwards, but the arthritis pain is gone as soon as you wake up.
Okay, you're at Crystal Clinic, you're in Montrose.
Correct.
So you do it right at that facility?
We actually do it at our hospital. We have our own orthopedic specialty hospital in downtown Akron, and we do all our inpatient surgeries there. So this is done at our own facility.
And how does insurance come into play for these things?
We can take any insurance. I have yet to see insurance that can't go through our hospital.
So, okay, so somebody's having a little pain in their hip. They're a little nervous about going. What's the first step? Who should call you? How do they know they should call you, and what's their first step?
Yeah, hip pain is usually up front in the groin. So a lot of people might point to their buttock. That may or may not be hip pain.
That might be just a bad neighbor or something, a pain in the butt, right?
Correct. So, if there's any doubt, talk to your primary care doc or come see us directly. You can walk right in, we'll get an x-ray and we'll tell you right away.
So a referral's not necessary?
Correct.
Yeah.
Yeah, just call our main number. We'll be happy to see you.
Okay, so what's the first thing if somebody comes in when they come in? What's the first encounter like?
Yeah, so they'll meet the physician. We're kind of like a cardiologist. They're going to want an EKG. We're going to need an x-ray. We want to see your bones, so we want to see what that cartilage space looks like.
And so if they have this problem and this pain and they say, okay, you're a candidate for this, how soon can you do it, and how soon could they hope to go back to work or go back to a normal life?
Right. Well, we'll try all the things conservatively that we would like to do. So we'll start with the simple things. You may not be a candidate just yet, but if you are at that bone-on-bone stage, then expect usually maybe a night in the hospital, full weight bearing right away. We'll get you walking on it the same day, and then see you back in the office in a couple weeks. And you're driving it 3 weeks, and life moves pretty quickly after that.
Do people think like I'm too young for this, it couldn't be happening to me, and then they don't go based on that also?
Correct. We see a lot of young patients too. It's amazing that people have been dealing with hip problems since they were little, and they just thought that's how it always had to be.
And it just makes it a more chronic situation by not fixing it.
Correct. Some people wait too long. So if you're having issues, come see us early.
And how long is this hip going to last, this good one you're going to give me?
Yes. We like to get you 20 plus years.
20 plus years. So there you go. There's your warranty.
Great.
Thank you very much. Crystal Clinic.
Great, thanks.
And he's in Montrose.